2026, remember this, 2026, we have ISH, International Society of Hypertension in the country. That's a huge achievement, of course, with our Emirate Cardiac Society. And with that, we have 6 or 7 societies with us. We have internal medicine, nephrologist, endocrinologist, neurologist, I think family medicine and cardiology together for that meeting. Tells you how important is this risk factor, okay? And that's devices. So the cases I show you, this is, I think you see it in your, this represent all what we discussed today. Look at this case. It's got all the risk factors to develop event in future. So if you see this patient in your clinic, what comes first to your mind? I think all of you agree to tackle the obesity. Yes, because that's the contributor to everything. So until that happens, it takes time. Obesity takes time to get reduced. This will happen if you don't contribute and intervene soon to the patients. These patients will have events, either stroke, renal, or heart attack. So we learn from the data we have, observation and the rest, that's leading cause of death is cardiovascular disease, but the risk factors is hypertension, more than 1 billion. And unfortunately, we're not doing well. We see everyone talks about we're not doing well. And in the Middle East, of course, the prevalence varies, depends where we look at, and it's like 1 in 3, 1 of 3 of us here got hypertension. You're aware of it or not? And that's, we all discuss this. It's not happening in isolation, it happens with other things. Like I'll show you 2 cases. And unfortunately, we're not doing well. And this is, again, coming from most of the studies. The guidelines here to help us to be more practical, not to be more theoretical. We don't want the big, so it's very easy. When not to treat, when to evaluate, when to treat. And these are the things to, to look and focus on when it comes to lifestyle. Lifestyle is important because that comes with you throughout the life. Okay, lifestyle means throughout the life. That means 1 week or 1 month or 1 year. Okay, throughout the life should be that. And we always, when we see a patient with hypertension, we assess, we risk stratify, we tell the patient where we're going, then together we achieve that shared decision. Everyone talks about that. So measuring blood pressure, I think this is, if I ask you this question, I think to apply to all of us. You've been to the clinic as a patient sometimes, or as for insurance business. How many times they applied all these principles to check your blood pressure? 0. I think for me, I've seen it. I mean, we're not doing, if you don't do this well, of course, everything will be, you're talking about something lifelong. So then when you come to management, you need to think about benefit and the risk. How much benefit you're going to do to the patient, whatever you're going to use, and then tailor it, that lifestyle to the patients. Patients' cost, patient preference, patient adverse, lots of things there. It's not just one. And then the guidelines tells you how to do that. To start with medication, they advise you to start with a combination. Why? Because combination has got less side effects, better synergistic, better adherence. Then if that failed, you have other way to do that. And to follow up. Follow up, I think, is important. And this is as I said, I already mentioned to you. So the barriers are many. Patient, doctors, government, many, okay? You've seen that many times I showed you. So with the new country, they have this combination, which I think you've seen it. RASI with CCB. RASI work on RASI system, okay? And the CCB work on you've seen it on the vasculature and to reduce the blood pressure. So two together, if you do it one alone, you might not get that, the pharmacodynamic and synergistic effect. The reason for that, and these are the challenges we face. The elderly, when it comes to elderly, we need to be careful. I know CCB works and diuretic works, but what about RASI? But put them together, they have the benefit of both. Diabetic, they get the benefit of both. Both are these RASIs. And the same with obesity, and that patient had all of them together. So this combination I've seen, I'm sure you've seen many companies talk about it. But this one today is this combination here, and this is available. And as mentioned, this synergistic effect of these two together, because amlodipine, CCB, any of the CCB cause what? Edema, you know that, huh? Flashing and all that. But in a small dose, less side. But you cannot give the small dose because the blood pressure will not be dropped. So to get the benefit of both, you give them together and you get better adherence, better target of blood pressure reduction, even in 2 weeks. We talk about 4 weeks, and 2 weeks you can get with this together. The safety I already mentioned with the CCB is less pharmacodynamic together. Is you basically will be very fast, the bioavailability, and reaching that in 8 weeks, it says, and really affect the diastolic, systolic, the 24-hour blood pressure. That's what you want, and without much of side effects, which you can get them in separate. Now, what about RASI? There are many of RASI available. Head-to-head comparison of this olmesartan to other, they found, better in terms of durability of the blood pressure control, because you want overnight to be controlled, because that's where the problem happens. And these are the drugs available. You have 40 by 5, 20 by 5, and by 10. And I already mentioned the safety and efficacy. So fast results, keep blood pressure check, 24 hours control for you, compared to other RASI, much better in terms of 24-hour control, adherence that we need with any combination, and reduce of edema. But go back again, what we want in this meeting is this. Is anytime you see a patient with heart failure, with hypertension, please confirm that, confirm it. Confirm it, it's very important. If you don't confirm it, you will be lost. Okay, risk approach. Risk based on the profile of the patient. Lifestyle, everyone talks about lifestyle, should be prescribed to the patient. Low dose combination is the best. Then follow up, based on that you will change it. Target this one, that's your target, as much as you can. ALARA, remember ALARA? As low as achievable, okay? And follow up, communication, shared decision. And thank you very much.